Have you joined us again? And the program is COVID-19. I do hope that we are all staying safe. And for those who are not staying at home, for those who have gone to work from Monday up to today, hope you're staying safe and ensuring that you're keeping, all hygienes as being directed, by the WHO. My name is Shegun Funmi Yudokun. Thank you so much for joining us again on this program.
Yes, it's another time to keep you abreast of happenings around, particularly over the pandemic, COVID-19, all over the world, in the country, and especially wherever you are in your state. So it's good to have you joining us again on COVID-19 update from New Frontiers Television. I am Temitope Oladipo. Good afternoon.
Yes, talking about keeping you abreast of happenings around the world, it will be of interest to note that a whole lot has happened between Monday that we're here and today, and just yesterday around 11:40.
Exactly. In hundreds and thousands, particularly in the banking halls, it was a gory sight to behold, because it's so unfortunate that Nigerians are not keeping to the social distancing as the principle has been stated by the NCDC. You need to see the number of people that came out, particularly at the ATM terminals. It wasn't it at all, and I think Nigerians should wise up and let's take with the principles, the guidelines as stated by the NCDC.
Yes, talking about SCDC, the truth of the matter is COVID-19 is real and it's really
very, very
happening in Nigeria. We cannot run away from that fact. Now giving us the statistics of how it has been increased with new cases being recorded as at 11:40 p.m. On the 5th of May 2020. Now the Lagos state still has a quite high number of 43. We have 32 in Kano, 32 9 in Katsina, 10 in FCT, 14 in Zamfara, 7 in Taraba.
And we also have 5 cases recorded, 7 cases recorded in Borno State, 5 was recorded in Ogun State, 5 also in Oyo, 3 in Edo State, 2 in Adamawa, 2 in Gobe State. Plateau State also recorded a case. Same thing goes for Sokoto State, where 1 case was recorded. And that brings the total number of confirmed cases of COVID-19 to 2,950 in Nigeria. The total number of discharged patients was at 481. And we also have some 98 deaths recorded as at yesterday, the 5th day in the month of May 2020.
Yes, talking about that, I will give us an active case presently now over 2,000, I hope it's 200, but it wasn't 200, 2,369. And looking at the total number of persons that have been tested so far in Nigeria is just 1,000, so why am I keep saying
wait, you have been okay, we should have a minimal figures.
Minimal figure, but unfortunately we don't have that now. Number of persons tested remains at 17,566 in just for Nigeria alone. Now moving straight to Africa.
Yes, as of 5th of May 2020, which was yesterday, we have 53 member states affected so far. And the member state reporting 47,118 cases. And this is how the breakdown went. We have 1,843 deaths, 15,587 recoveries. And we have state analysis from Lagos State with the total number of cases.
Yes, moving straight to the state analysis, just like she mentioned, we'll begin with Lagos State. Lagos has been on the top of the chart for quite a number of days now, and we have 1,226 persons, the total number of cases we have in Lagos. Now, breaking it down, we have 875 as active case, and discharge remains at 321, and number of dead is 30.
And now to Kano State, where we have a total number of case confirmed tested, laboratory tested cases of 397, and we have active cases of 388. 3 patients has been discharged, and Kano State recorded 11 deaths.
Yes, in Abuja, that's the FCT, a total number of 307 cases have been recorded. And the active case, a part of it is 264, with 40 persons being discharged and 3 deaths recorded so far.
And also in Gombe State, we have a total number of cases at 98, active cases still 98, and none has been discharged, and they haven't recorded any deaths so far in Gombe State. In
Borno State, where we have 106 total number of cases recorded, 92 is the active, discharge is 0, and death has been 14 in Borno State.
Still taking more update from the northern part of the country, in Katsina State, we have the total number of cases put at 92, active cases 78, discharge 6, and 8 deaths has been recorded.
Now, still southwest in Ogun State, we have a total number of cases recorded so far as 91, active 77, discharged patients 12, and 2 deaths.
And still taking more from the northern side, we have a total from Borno State, total number of 83 cases have been recorded in Bauchi State. Bauchi State. And we have 77 being active, 6 patients has been discharged, and no death has been recorded in Bauchi State.
So in Kaduna State, we have a total number of 84, as the total number, as 73 is the active case, and we have 10 discharged and 1 death so far. Yes, also in Sokoto State, we have 67, total number of cases recorded. 58 is active and 1 discharged and 8 dead.
Yes, from Edo State, a total number of 65 cases has been recorded with 51 active cases, 10 discharged and 4 deaths recorded in Edo State. And in Jigawa State, a total number of 39 cases have been recorded with 38 active cases. None has been discharged and 1 death recorded. And in Oyo State, here we have a total number of 44 cases. 33 are active, where 9 has been discharged, with 2 deaths recorded.
Years away from Oyo State, now to Zamfara State, where we have a total number of cases recorded to be 27. 26 are active presently, 0 persons have been discharged, and 1 death recorded. And also in Taraba State, we have 15 cases recorded, 15 are active, 0 death, 0 discharge. Adamawa State also has 14, as the total number of cases, active 14, discharge 0, death still 0.
Okay,
Right.
In Delta State, a total number of 17 cases have been recorded. Out of the 17, we have 13 active cases, 2 patients discharged, and 2 deaths recorded. Also in KB State, a total number of 13 cases have been recorded, and the 13 are active cases. None has been discharged, and no death has been recorded. In Yobe State, a total number of 13 cases have been recorded. 12 out of the 13 are active. None has been discharged, and they have recorded 1 death.
In Rivers State, a total number of 14 persons have been recorded. 10 are active, 2 has been discharged, and so far recorded just 2 deaths. We have in Ondo State a total number of 13 cases affected, and 10 has been active right now. 3 has been discharged. No death at all. That means 0 death in the record.
So in Nasarawa State, a total number of 11 cases recorded, and out of the 11 cases, we have 10 being active, none has been discharged, and 1 death recorded. In Ekiti State, which is part of the southwest region of the country, we have a total number of 12 cases, 9 being active cases, 2 discharged, and 1 death. In Kwara State, we have a total number of 16 cases, 8 active, 8 discharged, and no death has been recorded. Also in Enugu State, we have a total number of 8 cases. Out of the 8 cases, 6 are said to be active, 2 discharged, and no deaths recorded. And in Bayelsa, we have a total number of 5 cases, 5 also being active, none has been discharged, and no deaths has been recorded. And the total number of cases recorded in Ebonyi is 5 active, 5 non-discharged, and no deaths also recorded.
Yes, moving straight to Akwa Ibom now, we have 16 total number of cases recorded so far, and 4 is said to be active, discharged 10, that's a good one, and 2 deaths recorded. Now, in Plateau State also we have 4 total number of cases recorded, 4 still active, the whole 4, they are still active, with 0 deaths and 0 discharge. Now, Osun State, has 37 cases recorded with 3 active, discharged 30. That's a good one.
Of course it is.
But the death remains at 4. Yeah, 4. Now in Niger State, where the number is 4, that's the total number. 4, we have 3 active cases and 1 discharged and 0 deaths. And in Benue State, where we have just 2, which that's the total number, and the 2 are still active presently now.
Okay, now moving on to Imo State, where we have a total number of recorded cases put at 2. Out of the 2, 1 is being active, 1 discharged, and no death has been recorded so far. Abia State has a total number of 2 cases, 1 active, and the other 1 discharged, and 0 death also recorded. And in Anambra State, total number of cases is 1, active, none, discharged 1, and no death recorded.
Yes, that's the statistics that we have now, giving you in a breakdown of the total number of what we have that we did mention earlier, 2,950 cases.
Almost 3,000.
Yes, almost 3,000 that we have right now in Nigeria out of 17,000 persons that have been tested. Right now, that statistics given by the NCDC as at 11:40 p.m. on the 5th of May. 2020. Now, we would not hesitate to bring you any further update right here on Differences Television, but do stay with us. Now, we'll take a quick break now. Now, when we return, it will be time to have a discussion with a doctor. People, what we've mentioned, last week, this week, and is already in the news that our doctors are the front line. The medical personnel, not just doctors, but medical workers that are at the front line of these COVID-19, ensuring that I stay safe and everybody you also stay safe. Exactly. And we will need to go deep and ask some questions about what exactly is going on with this COVID-19. Just stay with us after some couple of minutes. We'll be back after this break, and guess what, you can be part of the conversation about that, the number that will be on your screen when we come back. And you can also drop your comment on our Facebook page, and that is at www.facebook.com/NFTV1, or go to our Twitter handle at NFTV1. Or you can drop a message on our WhatsApp number. It will be on your screen. We'll be right here to listen to that comment. We'll take a quick break now. Then when we come back, it will be time to bring in Dr. Adeleye Babarinsa.
This na public service announcement. To dey wear face mask dey help stop the spread of coronavirus, but e get other important matters wey you need to know about how to use face mask well. Number 1, you need face mask wey dem use cloth make, the one wey get at least 3 layers of protection and the one wey no go choke you. Number 2, even as you dey wear face mask, no touch your face with hand wey you never wash. Number 3, remove the face mask from your face with the handle, and if na the one wey you fit throw away, make you throw away am for inside dustbin. But if na the one wey they make with cloth, make you wash am, dry am, come iron am. Number 4, make you dey always wash your hand with soap and water before and after you remove the face mask. Make you dey do the personal hygiene things wey dem say make you dey do, and make you dey give people space. That na physical distancing. Dey safe, dey for house, dey responsible, do am for yourself and do am for other people. This message na from the Federal and State Ministries of Health, NCDC, and them partners them.
get infected by touching contaminated surfaces and then touching your eyes, nose or mouth. So disinfect commonly used areas regularly. The Federal Ministry of Health and NCDC are working very hard to ensure all people who fit the criteria have access to COVID-19 testing. If you experience any of this, please call your state number immediately or call NCDC. You can access your state emergency numbers here. Take responsibility, stay safe.
There are a lot of false information about the coronavirus. These are the facts. People of all ages can be affected by the coronavirus. However, older people and people with pre-existing medical conditions such as asthma, diabetes, heart diseases are more vulnerable to the disease. It is not for old people alone. Gargling salt and warm water or chewing garlic and ginger cannot prevent the virus. Drinking alcohol, hot lemon, palm oil or chloroquine will not kill the virus. The virus cannot be transmitted through mosquito bites. Antibiotics do not work against the viruses. Antibiotics work only against bacteria. Boiling pineapple peels, lime and ginger does not kill the virus. Putting raw onions in rooms will not ward off the virus. Using or spraying Dettol, special oils and water all over your body cannot kill the virus. There is no scientific evidence that cooking, drinking, or eating any of these is an effective treatment for coronavirus. Do not self-medicate and take responsibility by sharing only verified messages from health authorities such as NCDC, Federal Ministry of Health, and WHO.
Coming to you from New Frontiers Television. Just before we went on that break, we let you to know that we'll be having a medical personnel where we'll be asking questions as regards COVID-19 update, particularly those in the front line fighting against COVID-19, just to make sure that we all are safe in this country. On the virtual with us this afternoon is Dr. Adeleye Babarinsa. Is a primary care physician and he works with the Lalupon Primary Healthcare Center, Lagelu local government area of Oyo State. Dr. Babarinsa is a president and co-founder Creating Healthy Community and Kinship Medical Mission Incorporated. It is a registered and a licensed establishment. Good afternoon, Dr. Babarinsa. The development recently in the fight against COVID-19 in Nigeria is the issue of community transmission. Now, how possible is it for community to contract this virus?
Government approach, on this transmission and spreading, transmission of COVID-19 in Nigeria so far, the government approach, how will you assess that?
The question again.
All right, I asked that, how will you assess government approach, so far to the transmission and spread? You did mention about community transmission earlier. So how is the government approach, towards these, helping in the
Ask you is for information's sake and just to educate our viewers more on the symptoms and the signs of COVID-19. I think it's imperative for us to reiterate what the symptoms for COVID-19.
First angle that a whole lot of persons, okay, today the statistics we have is that 17,000 persons, have been tested. 17,000 persons have been, tested so far. There we discovered, 2,950 cases. Now, how far has been the test? Is it the speed at which persons have been tested, is it good enough for us in Nigeria now? Looking at the statistics of how many people we have in Nigeria, a population of 200 million, approximately in Nigeria now, and just 17,000 persons, has been tested so far. Don't forget that Lagos State did, come out to say that some of their test kits and reagents are not available. Likewise in Kano State.
Doctor, now let me ask you what your opinion is on the ease of lockdown in Lagos State and the Federal Capital Territory, Abuja. appreciate you from COVID-19 update. Thank you so much for joining us.
All right, now moving ahead with the program COVID-19. We just listened to Dr. Babarinsa, giving us insight into some of the happenings there. You can join us again. We're bringing in another doctor on Friday for us to have in depth, understanding of what exactly is going on, with this COVID-19 pandemic. And right now, I'll take some news within Nigeria. But just before that, you can be part of the conversation by that number right on your screen, or you can make a comment on our Facebook page at TFTV1, or our Twitter handle at TFTV1, or the number right on your screen at the WhatsApp message. Right in Nigeria, presently now 10 doctors, not less than 10 doctors, medical doctors have been tested positive for COVID-19 at the Aminu Kano Teaching Hospital as in Kano State. Now, the chairman of the Association of Resident Doctor, Dr. Nagona, made the confirmation in Kano. He did say that doctors were treating patients and who came to the hospital with symptoms which was later discovered to be COVID-19. And he said that 8 of the infected doctors have been sent to isolation centers, while the remaining 2 have gone into self-isolation in their respective home as they were yet to develop any symptoms. Now, however, he attributed the vulnerability of the doctors to the absence of adequate personal protective equipment, as well as the failure of patients to wear face masks when coming to the hospital for treatment.
Yes, still taking more news updates on COVID-19 within Nigeria as the COVID-19 patients hit the street in Gombe State to protest over hunger in isolation. Some COVID-19 patients staged a protest at the Federal Teaching Hospital in Gombe yesterday, destroying some equipment in their ward. The patients who were under quarantine were said to have complained of ill treatment. A security source told newsmen that after 30 minutes, some officials in the hospital pacified them, promising that there would be improvements in their welfare. It was gathered that while the protest at the hospital was ongoing, some COVID-19 patients in Kwadom Isolation Center in Yamalitu, Deba local government area of Gombe took to the streets, also lamenting poor treatment. They were said to have blocked Gombe Bill Road, chanting anti-government songs.
So much positive that you will want to hear the story about the presidency who have said that they may approve the local hubs, to battle COVID-19. According to the Minister of Health, Dr. Osage Nairi, it is told the House of Representatives that President Muhammadu Buhari's government was open to the possibility of using local hubs to fight COVID-19 pandemic. But he did insist that the Nigerian Institute of Pharmaceutical Research and Development must first certify any of such remedy. Now, a higher will disclosed these when the Presidential Task Force on COVID-19 briefed the members of the House of Representatives. Also said that it was wrong for any hospital to turn back patients as a result of the fear of the COVID-19 virus. Now, the minister did say that the government was not ruling out the possibility of using local hubs for the treatment of this disease. It added that what government is saying right now is that they need to have a substantial test to ensure that this is available for the people. It did say local hubs could be categorized into drugs that could cure the virus or those that could reduce the symptoms, and noted that the body must be able to build the required antibodies to neutralize the virus.
Well, which I think it's a good development from the federal government. It's not that they are kicking against the use of apps, but there is a body that has been set aside to look into how it will treat it, or at least reduce the symptoms of the virus. And still taking more news within Nigeria on COVID-19, we have Lagos State battles shortage of reagents. FCT runs out of test kits. The Lagos State government had said it was battling with a shortage of reagents. The Federal Capital Territory, on its part, said it was facing the shortage of test kits. And currently, the state with 365 cases, it's second only to Lagos State with 1,183 cases as of 5 p.m. on Tuesday. The Presidential Task Force on COVID-19 at the House of Representatives on Tuesday said Kano State had become the epicenter of coronavirus in the north.
It's interesting to have some updates too on the foreign news. Now I'll start with the one in Britain, where the death toll from the coronavirus has toppled by 32,000, which is according to some official counts being released on Tuesday. Now the new toll from the Office of the National Statistics and the regional health bodies have not yet been incorporated into the government daily figure, which records the current number of deaths as 29,427. Now, that is still higher than that of Italy, which on Tuesday recorded 29,316 virus fatalities to date, but far short of the United States, which nearly has 69,000 people who have died from this pandemic.
Oh yes, still taking more news from outside Nigeria to look at some of the things that is happening outside Nigeria. We have coronavirus. White House plan to disband virus task force. President Donald Trump of the United States of America has confirmed that White House coronavirus task force will be winding down, with Vice President Mike Pence suggesting that it could be disbanded within weeks. New confirmed infection per day in the United States currently top 20,000 and daily deaths exceed 1,000. The U.S. health officials warn the virus may spread businesses begin to open. The United States currently has 1.2 million confirmed coronavirus infections and more than 70,000 related deaths, according to Johns Hopkins University in Baltimore, Maryland, which is tracking the pandemic.
Now, talking about the reopening, moving straight to China, where the school in Wuhan has returned to school as they are the Chinese youngsters in the global virus epidemic center in Wuhan are back to school today, wearing masks and walking in single file past their terminal scanners. Now, senior school students in 121 institutions were back in front of their chalkboards and digital display for the first time since that city was reopened, and the ground zero of the coronavirus pandemic that they did shut in January 2020. Now, teenagers sat at individual desks to have a space of 3.3 feet apart, seeing their teacher in flesh after months of distant learning. Now, the Wednesday back to school, that's today's back to school, was the latest step in the gradual normalizing of life in Wuhan and the surrounding Hubei province, the city where the coronavirus appeared late last year, before spreading across the world, was locked down for 76 days. And that's a whole lot for 70. The city was locked down for 76 days and only reopened last month.
And it will interest you that we have some update from the sports, where we have, to the lovers of sport, it's a good news that Bundesliga to return in May. Berlin plans to allow Germany's Bundesliga to restart behind closed doors in May after weeks of shutdown imposed to control the spread of the coronavirus, according to a draft government agreement. Politicians believe restarting play in the first and second division to limit the economic damage for the 36 clubs is acceptable, the document showed. Chancellor Angela Merkel and state premiers will set a date for the games to begin in a telephone conference later today, with German India reporting May 21 was a possible candidate. And Germany's influential DFL Football League has long urged restarting play, which it says is vital for a sector that employs 56,000 people in Germany. It also offered authorities a strict infection control plan based on numerous coronavirus tests, which it says will allow the competition to be relaunched with low risk. Health Minister Jens Spahn has judged the scheme makes sense and can serve as an example for other forms of professional sport, although it has to be lived up to.
I think that's a good news for those who love sport. Yes,
exactly.
dearly, that Bundesliga might be reopening anytime soon. Just before we move ahead now, I'm going to take some cases globally, updates just for to remember total confirmed case in the whole world presently as at today, the 6th of May 2020, stands at 3,743,654, and we have the total number of recovered to be 1,248,705, and we have the number of deaths in the world to be 258,850, and the new confirmed cases remains at 19,136, and that's what we have. Now, let's take some steps for us to have some preventive preventive measures, for us to follow, so that we can, curb the spread of these coronavirus as much as the federal government is doing theirs and the state government.
We also have our responsibility.
Yes, we do have responsibility. Ensure that you clean your hands often, use soap and water or an alcohol-based
and sanitizer. Exactly. We've been hearing this over and over again, just to reiterate it to us again that coronavirus is real. And as we have heard from the doctor, that it's everywhere. In just few states in Nigeria that have not recorded any cases of coronavirus. So you maintain a social distance, a safe distance from anyone who is coughing or sneezing. Don't touch your eyes, your nose, and your mouth. And cover your nose and mouth with your bent elbow or a tissue when you are coughing or sneezing. Stay at home if you feel unwell, and if you have a fever or a cough and difficulty in breathing, seek medical attention, call in advance. Follow the directions of your local health authority and avoid unneeded visits to medical facilities that allow healthcare system to operate more effectively, therefore protecting you and others.
Thank you so much for joining us as much to be able to take today. It's time that we need to leave. Yeah. We'll come back again on Friday. Join us at the same time, 1 p.m. on the station. I'll be looking forward to having you also on Friday. My name is Shegun Fumiyidoko. Enjoy the rest of your day.
And I am Temi Tokwe Oladipo. Let's continue to stay safe. It's goodbye for now.